when you start the sport and you start hurting, aching, there are niggles and pains, in the start we start to ignore and we'll be like, yeah, it's part of like no pain, no gain types.
As soon as you cross the age of 25, and it is literally like flipping a switch. At age 24, you do night outs, you can still perform the next day morning. At age 26, you do a night out, you're out for the next 2 days. Your brain is a bit of a haze. If you're not taking care of yourself after the age of 25, you are going to get hurt. Even the nutritionist doesn't meet the athlete on a day-to-day basis. They have their regular sessions, and the nutritionist talks to the chef who cooks food for them. Athlete is just given a choice that, okay, you want pasta, you want this, you want that, and it's the chef's job to make sure that, okay, if Vikas has ordered pasta, his protein requirement is so much, so I need to put in some stuff into it.
Someone sees a sole in the shoe and they think there is a cushion.
Yes.
One of the ways that I suggest to people is that if you run in the shop and if you can still feel the ground in a hard way, that's not cushion, that's not good cushion.
Yes, I agree. That's actually a good way to...
Right? And if it's too soft, that it's feeling like foam, that's your mattress at home, that also is not good cushion.
That also is not good, because then your balance goes for a toss.
Exactly. So there has to be a balance between...
I mean, if you're running on Mumbai roads, your balance can't be a problem.
Yeah.
You'll end up with ankle sprains every day.
True. Dr. Latey, it's been a long time coming. And finally we are speaking. It's an absolute pleasure to have you with us today.
Thank you for having me.
We've been speaking for years. We've been meeting for years, mostly when I'm limping.
Yes.
But today, in another setting, which is not the case that I'm limping, by now people would have also understood who am I meeting with. We're discussing all about prevention from injuries, and we are talking about a bunch of things that will help us to be better in our performances, that is endurance. We'll talk about all of that, but how would we start with an introduction of yours to people, to listeners who might not know of you?
So I'm a physiotherapist and a sports scientist, and my journey actually started as a swimmer. I used to be a short distance swimmer, 50 meters, 100 meters, and then I somehow got into long distance and I really did well. So I was thinking, when I say long distance, I mean open water. I was like, if somebody had told me earlier, maybe I could have done a bit more, that, my body is more suited for endurance kind of events. This was 30 years ago. So
Wow.
At that point, there was no such thing as sports science in India. So the closest thing that came to it was physiotherapy.
Okay.
So after 12, gave my pre-med exams, and I was getting MBBS, but I didn't want to get into that field. So I did a physiotherapy and practiced for a couple of years. And then I followed my passion and went into sports science. So I did my sports science from the UK. And after I came back, I joined an organization called Olympic Gold Quest. It's a not-for-profit organization that supports some of our top athletes. I was the head of sports science and rehab there. And I was able to help some of our athletes at the games. I've been to London and Rio Olympics. I trained Mary Kom for the London Olympics, where we got a medal. I trained some shooters for the Rio Olympics, where we didn't get a medal. So saw both sides.
Awesome. And also you as an athlete, you did fairly well as well.
I was middling, because at that point, open water swimming was nowhere. It was just local competitions. The first time open water swimming got introduced at the Olympics was in 2008 at the Beijing Games, at which point I was already doing my master's in UK. So I was out of the sport by then.
Got it.
And then one endurance bleeds into another. So I had a fair crack at running. I've done a few marathons, plenty of half marathons, but my favorite distance is 10K. I really enjoy it. And so swimming is something I do engage in from time to time. But yeah.
10K is what you'll be doing this year in our half marathon.
Yes, I will.
Awesome. Already putting it socially so that you're obligated.
Oh, yes, I am. Trust me.
Awesome. Now, the point I want to discuss more in detail today is about physiotherapy, particularly sports physiotherapy. And why I say this is because when we as recreational runners, we undertake endurance sport such as running or triathlon, we do not incorporate physio as a part of our training. I hear of training and some outliers also consider nutrition when they are training, and so you'll find a lot of people who are training well and some people who are training well as eating well. But rarely do I see people incorporating physiotherapy in their program. I wanted to understand, what is physiotherapy and is it even needed?
Let me tell you how a high performance athlete trains, and that will give you a good idea of whether physio is needed or not. So, in a high performance setting, the most important person on field is the coach. The second most important person on field is the strength and conditioning coach. So, as long as the coach and the SNC do their job, the athlete is fit, fine, training, and doesn't need to see people like me at all. Okay, so we are in the back rooms.
Okay.
Even the nutritionist doesn't meet the athlete on a day-to-day basis. They have their regular sessions, and the nutritionist talks to the chef who cooks food for them. So the athlete is just given a choice that, okay, you want pasta, you want this, you want that. And it's the chef's job to make sure that, okay, if Vikas has ordered pasta, his protein requirement is so much, so I need to put in some stuff into it. So that is how a real high performance setup works, where the athlete interacts with the coach and the SNC on a daily basis, with the physio only when they get injured, which happens often in a high performance setting. I mean, you're always pushing yourself. And the nutritionist on a regular basis, and the nutritionist's job is to deal with the kitchen. That is how a high performance setup works. In an amateur setting, yes, the coach is still the most important person that you need to deal with. Unfortunately, not everyone works with an SNC, a strength and conditioning coach, and that is where physios come into play. So if you are working with a coach and doing your regular strengthening and not being pig-headed, listening to both of them, then you don't actually need a physio. So what does a physio do? A physio is someone, so if you take a personal trainer who knows a lot about exercises, but very little about the medical side of things, the surgery, the injuries, the bones and muscles. And you take an orthopedic surgeon who knows everything about the medical side of it, but not so much about strength and conditioning. Physios are in the spectrum in between. So there will be some physios who are more towards giving strengthening exercises, more physios who are more towards pre-op and post-op care, immediately after surgery, what kind of workouts need to be done to get them back into standing, back into regular activities. The entire spectrum, you can see physios working. A sports physio is closer to the first part, where they know about medicine, they know a lot about exercise, they know about the sport, and they're not technically dealing with pre-op, post-op care, although they can do that.
Yeah.
But they're more into fine-tuning your body for the sport you're playing in. So giving you specific exercises, which a strength and conditioning coach may or may not always give you.
Yeah.
Something like that.
Yeah. Also, I think with the amateurs, as they start training, their adaptation is significantly different than the high performance athletes, also because they may be starting the sport later in life. And additionally, that they have day jobs, they have other responsibilities to undertake, and their bodies have a history where they not necessarily are ready for the kind of impact that the endurance sport will be taking. When you start the sport and you start hurting, aching, there are niggles and pains in the start, we start to ignore, and we'll be like, yeah, it's part of like no pain no gain types. And over a period of time it becomes unbearable, and then you start to figure out, do I take medicines, painkillers, go to a physio, go to a medical professional, or stop running for that matter?
Straight go and get an MRI. I do have patients walking to me with an MRI. See, basically, if you are under the age of 25, okay, you can abuse your body and still sort of get away with it. Okay. As soon as you cross the age of 25, and it is literally like flipping a switch. At age 24, you do night outs, you can still perform the next day morning. At age 26, you do a night out, you're out for the next 2 days. Your brain is a bit of a haze, right? So it's literally like flipping a switch. If you're not taking care of yourself after the age of 25, you are going to get hurt. Okay. But at the same time, if you do take care of yourself, just a few basics, just be mindful of what the coach is saying, engage in some strength and conditioning, eat well, sleep well. Your body will support you better because it has more endurance, more miles in your muscles than you did when you were 20. So if a 40, 45-year-old suddenly decides that, I'm set in life and now I have some brain space to pay attention to myself, work is set, family is set, and you get some brain space. And suddenly you're at your middle age and you want to take up running. Good, no problem, please do. But understand that you probably haven't engaged in sport for good 2 decades, right? So you can't start the car in third gear. You have to start it in first and slowly go your way up, and just listen to your body. A lot of people don't do that. Like you said, you have niggles, you ignore it, and then it becomes a problem. So step one, don't ignore yourself. Listen to your body. Step two, if you do get an injury, go to a doc, let them diagnose and figure out what's wrong.
Yeah. And the point of MRI is so true. I remember back in 2010, once I had a knee pain because of running. I think I'd done a Mumbai marathon around then, and then I was during my recovery period, I was having this niggle in my knee, and I went to one of the popular physios back then, and one of the first things I was told to take a MRI. And I was wondering, I said, why? I'm just not able to get it. So I was told that you might have these many issues. I was so frightened. I came back from their home. I didn't go to work thinking, do I need to get my knee replaced and things like those. So yeah, there are other extremes, but fortunately none of that was the case.
Yeah.
And I never went through that MRI.
And you're still running fine.
And running fairly okay, right? Touch wood, almost no
Yeah.
injuries ever. Sometimes I happen to see you.
Those are niggles,
right?
fine.
And I don't ignore them. So talking about amateurs and thinking from an injury point of view, a lot of times what happens is we are not informed or we are not educated to understand or differentiate between niggle that's coming out of my training,
Yeah.
which is just a byproduct of it, and something that's in excess, which is due to overtraining, that could be an injury, etc., that is coming my way. And from my experience, I have found 2-3 such issues that people come and ask advice. I'm no expert, so I transfer them to people like you, for example, or will ask them to some literature that I might know of. Let's pick up those things one by one and go through just the basics to understand.
Of course.
Starting from the first impact point, first contact point as we start to run, that's our feet.
Yeah.
As runners start to run, they think of shoes, they think of better shoes, they think of carbon shoes, they think of pronation. They think of socks as well at times. Now, what is it that people should keep in mind that will get them to select the right shoe? There is also discussion about insole and things like those. And then later when they go and see a doc, they go and see an expert, they may be told that, hey, you need to have an insole, you need to have this and that, etc., etc., and the person is all confused. How should someone start?
Okay, let's simplify this.
Yeah.
Okay. Number one, your body is used to the feet you have. Step one. Okay. So that's just it. It's not that you're born with the wrong feet. Your body is used to it. We see the Paralympic Games. We see what those amazing athletes are capable of with genuine disabilities, right? Not that, one foot is shorter than the other by 2 millimeters. So they have genuine issues, and they are able to train and perform at a level you and I can't even dream of, right? So firstly, your body is used to your feet. Now, if you have picked up running, you are increasing the impact on your feet. So I would suggest buy a shoe which has got good cushioning. Wear the shoe. Don't buy online initially. Wear the shoe, jump in it, walk in it, see if it feels comfortable. If it is comfortable, it's good for you. As easy as that, right? The second thing people wonder about is about pronation. Okay. So again, your body is used to the feet you have. So if you have pronating feet or flat feet, and if you suddenly wear a shoe that corrects it, you may be shifting the weight somewhere else and cause pain somewhere else.
Yeah, it will dissipate further up.
Yeah, usually at the knee or the hip. So wear something that feels comfortable and cushions the impact of the running. Because initially your muscles, your ligaments, your joint linings, they are not strong enough, resilient enough, and elastic enough to take the impact load. So initially you need that cushioning that the shoe provides. With time, as your body adapts to running regularly, your tendons, your ligaments, your muscles, they get used to those impact forces. At which point, if you do want to go for slightly lighter shoes which have less cushioning, you can. But you're talking about a timeline of at least a year or year and a half before you think about doing it.
True.
Right? Especially if you're picking it up. So that's about choosing the right shoe and how pronation matters.
I think when we are saying cushioning, it's fairly relative. Someone sees a sole in the shoe and they think there is a cushion. I think what we are talking about is a cushion that is absorbing some shock as you are running in them.
Yes.
One of the ways that I suggest to people is that if you run in the shop with the shoes on, and if you can still feel the ground in a hard way, that's not cushion. That's not good cushion.
Yes, I agree. That's actually a good way to
right. And if it's too soft that it's feeling like foam, that's your mattress at home, that also is not
that
good
also
cushion.
is not good because then your balance goes for a toss.
Exactly. So there has to be a balance between.
I mean, if you're running on Mumbai roads, your balance can't be a problem.
Yeah.
You'll end up with ankle sprains every day.
True.
So yeah, and we just had our first train, so the roads are in spectacular condition.
I know, it's a trail runs.
Absolutely. Anyways, so you're right. Yeah, it can't be too soft, and you can't when you're jumping in those shoes in the shop, you shouldn't be feeling a hard poke from the ground underneath. So that's actually true. The second part is insoles. To my mind, if you have no pain, don't wear an insole. Right? Insoles, your foot takes about 5 to 7 times your body weight minimum when you run. Okay. If you are, depending on the way you run, it can go all the way up to 10 times. Like sprinters and all, easily 10 times their body weight. So if you are someone who weighs 60 kilos, you're talking about more than half a ton of pressure every single step. And if your cadence is 170, then that's 85 times a minute that your foot is banging on the floor at 600 kilograms of pressure for whatever time you're running. If you look at normal insoles, you can bend them with your thumbs. Right? They're not strong enough to take that kind of pressure. So they're not holding your arch up. So what they are doing is they are slowing down the speed of collapse, allowing your muscles and your ligaments and your tendons to do the job that they are supposed to do.
Got it.
Right? But if you're not in pain, that means your tissues are already doing the job that they are supposed to do.
True.
And they don't need extra support.
Yeah.
That's point one. Point number two, if you do have pain, you can consider wearing an insole in the short term. But like I said, insoles aren't that strong. I mean, they wear out in 6 months.
Yeah.
You can wear it as an intervention while you work on your muscles.
Yeah.
But at the end of the day, your muscles have to do the job.
Yeah, that's a very important point because the long-term solution is not keeping the plaster on, right? Or as we were discussing backstage, that put a plaster today thinking that you will be protected from any future injuries.
If you have a cracked bone, wear a plaster, but you can't wear a plaster to prevent a bone from cracking.
Yeah, in future.
Yeah, right. That doesn't work. Yeah.
Also, when we think of insoles, it seems like insoles have been made so popular through marketing efforts that nothing else seems an alternative to it, right? I always say also in another way,
kind of like pronation, isn't it?
I know, right? I always say this, that if insoles were that great, why would some of the best running brands will not create those kind of insoles in itself, right? Why will they not have a separate brand to just create that? Why will they continue just make good quality shoes to even start with, right? Now, when we say that we should put the insoles for a temporary period of time and work on the development of the muscle strength, etc., I think we are talking about strength training, isn't it? Right? And feet specific training. I a lot of times I see in the gym people confused. What should they be working out? Same biceps, triceps, shoulder, chest. Doing a push-up is not going to strengthen your feet.
No, it's not. When you're running, your calf is kind of like your accelerator and your quads is kind of like your brake.
Yeah.
Right? So you need those two. You need to strengthen your calves. You need to strengthen your quads.
Yeah.
So when you're sprinting, running faster, doing interval training, your calves are working hard. And when you're doing hill training on the downhill where you need to apply the brake, your quads are working hard. Right?
Yeah.
So those two definitely need to work. If you are having foot issues,
Yeah.
then another muscle, your shin muscle, your tibialis posterior, becomes very important because it supports the entire arch.
Yeah.
So that becomes an important muscle. But that is for people who have issues with the foot. If you don't have issues with the foot, your muscle is adapted, it's doing its job. But the calf needs strength, the quads need strength. And the third muscle, two more muscles which absolutely need strengthening are your big buttock muscle, the gluteus maximus,
Yeah.
and your hip abductor muscle, which is the gluteus medius. The hip abductor muscle is the one that shifts your weight from one leg to the other. So pretty much every single step that muscle is working. And if that muscle is weak or not doing its job, it pulls on the IT band, you get IT band issues, and then things start progressing from there.
Yeah.
Yeah.
Very, very valid points. Now, staying at the feet, and we'll move up in a bit.
Yeah.
Uh, um, flat feet or pronation is something that's discussed so much, and it continues to be one of the most searched items, one of the most asked items, etc. And also, you said if you have foot issue, then go for any of the interventions that are needed,
Yes.
for example. But the worst part is, I have a headache today, I can go all the way and correlate for it to be any possible disease.
Yes.
And so I'm saying I have a little niggle, I might say I have a foot issue.
Oh, yeah.
Right. So how do I differentiate between it being a temporary issue versus something that needs attention to start with, and particularly around feet?
So if it hurts, you should definitely pay attention to it. How much attention will depend on how much pain. So if you have a mental scale of 0 to 10, okay, where 0 is absolutely no pain and 10 is the kind of pain that even prevents you getting out of bed. Okay, that's a horrible, horrible pain.
Yeah.
So on that scale, if you're less than 3, it's a niggle. And usually when you go faster, that is when your muscles are not able to adapt and you end up with some kind of a niggle. So if you are less than 3 on 10, it's a niggle. Slow down, ice that area or stretch that area or give it a couple of days of rest and it will subside.
Yeah.
If you have ignored it when it was 3 on 10 and you have allowed it to go beyond, but less than 5 on 10, then you might need some kind of intervention from a physiotherapist who does releases, who does supportive structures, gives you specific exercises, etc., because you allowed it to get away from you.
Right.
You could have stopped it earlier had you paid attention, but ho jata hai. Like you said, you are training for a competition and you have this thing that you need to get ready, you need to put in the miles, otherwise you won't be ready. That actually is a big trigger that people want to make sure they do their miles, and so they push past pain to do their miles. That's one of the things that happens. If it goes beyond 6 on 10, then something is hurt. Then you'll definitely need some duration of rest depending on how bad the pain is, and you will need to see a doctor.
Got it. And this pain we are talking about while loading, or is it even at rest we are saying?
If you are having pain at rest, it's already 6
It's
plus on 10.
Right.
Pain at rest is, I would say 7 or 8 on 10. That's significantly high.
Yeah. And at times, and not to make it too generic, but at times some of the pain goes away when you are fully warmed up.
Yeah.
What is it then?
It's muscular.
Got it.
It's muscular because when muscles warm up and blood pulses through the muscles, your feeling of pain comes down. Or should I say the inflammation inside the muscles, which is causing the pain, gets washed away slightly.
Okay.
But the injury is still there, so it's going to come back. Right. So when you wake up the next day morning, it is still going to be stiff and painful.
Got it. Got it.
But that's a good sign that if after warm up the pain is coming down, means the injury is not too bad. And if you just reduce the speed and take a little care, should solve by itself. Yeah.
And actually one of the examples that that I have seen, one of the situations that is this tenderness back of my heel.
Oh, yeah.
The Achilles, it becomes so tender that after a long run, if I touch that area or it gets touched somewhere with the wall or something, seems like someone just shot me.
Yeah.
But if I rest it for a few days, it gets better.
Your body heals itself, doesn't it?
And also if I reduce my intensity of training, over a period of time that also heals.
Yeah.
I've seen. So I think that's one of the examples.
Yeah, that's the impact injury that I'm talking about.
Right.
Because like I said, your calf is working every single step to push you forward.
Mm.
So if you're running either distances longer than what the muscle can handle or faster than the muscle can handle, right, then it is going to hurt. So a good way to think about muscle and bone is you have a wall, you have a hook attached to that wall, and you have a rubber band on that hook, right? So the wall is the bone, the hook is the tendon, and the rubber band is your muscle.
Okay.
Now, if you pull the muscle sharply, if you
Right.
pull the band sharply, it's going to break.
Yeah.
Right? So that's a muscle tear.
Yeah.
That is what happens when you try to lift a really heavy weight.
Yeah.
Right? Or try to put it down. But when you're running, you're not doing that. You're repeatedly pulling on the rubber band.
Yeah.
So it's not powerful enough to snap, but it is powerful enough to start tugging on the hook a little bit. And then the hook and the bone, where the hook and the wall where they join, it starts to wiggle around a bit. You can imagine that, right?
Yeah.
That is the issue that you face. That because the muscle is constantly working, where the tendon inserts into the bone, it starts to get inflamed. One of the things that cause this are muscle imbalances.
Got it.
Putting weight equally on both your feet, but one calf is stronger than the other.
Right.
So one of two things will happen. Either that calf overworks and gets injured, or the weaker calf is not able to keep up with the pressure, and that gets injured.
Right.
So typically what I see in my practice is a lot of people prepare for the Mumbai Marathon, right? Thousands and thousands of them. And between say November and towards the end of December, in that 2-month period where volume is pretty high of running, I see the weaker calf getting injured. Because the speed is not that high, but you're doing repetitions again and again. In the last 3 weeks, when the volume comes down, intensity goes up, and people are doing their intervals and such, I see the stronger calf getting caught up. Because now you're putting an excessive load on that calf to push you faster.
Right.
And that is something I see every year.
And it just makes so much sense now as we talk through it. If people are attentive, they would have understood why it is the case.
Yeah.
Got it. What is up with flat feet?
Nothing. All right. So in my practice, okay, this is not data that I have seen in papers. This is just touching people's feet for a living.
Experientially,
right?
yeah.
So 85% of Indians, I don't know about others because I treat Indians, don't have any ankle movement. So if you consider this as the ankle, and I'm able to push from the top, it goes up, right? But if I lock the foot and I try to go up, the ankle itself has no mobility. It doesn't come up. It barely comes up to neutral.
True.
So when you're standing and you're walking and your ankle needs to bend forward, there is no movement. So the midfoot starts compensating. The arch comes down slightly and you go over. So instead of the ankle bending forward, the midfoot compensates. And there are 26 bones in your foot. So they have plenty of space to do those micro adjustments. In your teens, in your 20s, you may have a very good arch with a stiff ankle. But because of this repeated crashing with every single step, the elasticity, the bounciness of the tissue sort of comes down. And I've seen people with really good arches in their 20s have flattish feet by the time they're 50s. Okay. But that is a perfectly normal, perfectly natural adaptation to the ankle. And it's not a problem. Then you have people who are like me with, poor foot architecture who have absolute flat feet, flat like a chapati, absolutely no space underneath. But I'm adapted to it and I'm not in pain. Right. So it's not about whether you have flat feet or not. It's whether are you used to it or not. And arches develop between the age of 2 and 9. So I sometimes get 5-year-old, parents are worried that this guy has got flat feet. And I'm like, don't worry right now. He can still or she can still develop arches. The arches can develop before the age of 9. All you need to do is make sure that doing plenty of running and jumping and hopping so that the muscles become strong, the tendons become strong, and they're able to support the bones better.
Got it.
That's what needs to happen. Got it. There are certain cases where 13, 14, 15-year-olds who are in the middle of their growth phase, who are playing competitive sports like football and badminton, where there's a lot of impact on the foot, have flat feet and do end up with problems of related to flat feet, and those need to be tackled in a clinical manner.
Mm.
So I'm not saying all flat feet are rubbish,
Yeah.
but for the majority of population, if you're a 40-year-old who hasn't run and you just pick up running and you get foot pain, and people say it's because of flat feet, it's really not, because you've had flat feet all your life.
Yeah.
It didn't hurt.
Yeah.
What changed was you started putting more impact on your feet.
Yeah.
So maybe you need to reduce the impact and improve the strength, and you'll be okay.
Yeah. And I think one of the most ignored set of exercises is feet related exercises. People don't even know that you can actually exercise your feet. Right? And I think all of us are we are victim, as well as I think our ignorances are these are some of the things that to blame. But we will go to a gym or anywhere else and we will go flex our muscles that we can see, and those are the ones that we'll train, instead of training the ones that require a lot more training. And I always say, if we have to prioritize, our first contact point to the ground is our feet. We should start training from there.
Yeah. And your postural muscles, which again you can't see in a mirror.
Yeah, I know.
So if you're standing in the mirror, you'll see the muscles in front of you and not those behind you, and not the feet which are inside your shoes.
Yeah.
So, yeah.
Moving up, shin pain
Yes.
is another question that keeps coming. And actually, this issue is prevalent in two set of population, in my understanding, experientially again. One is the younger kids, the teenagers, the younger adults who are training for speed, and whether it's army bharti and these kind of things. And a bunch of times I keep getting questions that their shins hurt and how. That's one. Second is when people are amateur runners who are starting out training and they start to have shin pain. Would you be able to throw some light on what is the fundamental of the shin pain and why is it happening?
Yeah, so there are two causes of shin pain, two different structures which get affected.
Sure.
First is your shin muscle. So with amateur runners who pick up running, usually that's the cause, where the muscle isn't strong enough to support the foot with the kind of impact it has to face, right? So it's usually muscular. With strengthening, with following a few basics, things improve, and especially with time, because your body adapts with time. So if you don't have a goal of, say, running a 10K in your first year, half in your second year, full in your third year, comrades in your fourth year, and retired by the fifth year, if you space it out, you'll be okay. Your body just needs adaptation. I know you're laughing because you know so many people who do that.
I just went through an experience last week. Someone who had reached out to me.
So if you're patient enough, the muscles will adapt, become stronger. It's a new activity. Any activity you start new, there will be some aches and pains, and you'll grow out of it. If you do specific strengthening, even better. With the other tissues that get affected around the shin is the shin bone, right? And with the younger population, that is usually one of the reasons. And this happens because of low vitamin D levels. So if your vitamin D levels are low, and I mean, we are in the room with no sunlight right now, right? All of us work indoors. Even if you do go out, I mean, if I go out in the sun, only a little bit of my hands is exposed. So all of us have vitamin D being low unless you specifically take something for it. And that causes the bones to get weak. So when you run, the body weight comes from above, the ground reaction force comes from below, and the middle third portion of your shin bone is where that focus, where the two meet. So in a lot of these athletes, the kind you're talking about, if you touch the middle portion of their shin, it'll feel warm compared to closer to the ankle or closer to the knee, because there's swelling in the bone. So if you want to take care of swelling in the bone, you need to up the vitamin D.
Wow. I've also seen that if people select shoes that are not of great quality, that increases the impact upon loading. And could that be that there is dissipation of impact towards the shin?
Honestly speaking, it's all about letting your body adapt to it. Right. Like you have shoes now, but 20, 30 years ago, people used to run in canvas shoes. Right. It's all about letting your body adapt to it. People run bare feet. Okay. Just give it time to adapt. If you give it time to adapt, don't push yourself. Whenever you hit pain of 3 on 10, you
Yeah.
reduce the speed, give it some more time, let your body get used to it,
Yeah.
and listen to your body and keep adapting. It's not a problem.
Yeah. No, I agree, and also slightly philosophical, but I totally believe in it, which a lot of younger athletes don't listen to. You should make a choice when you can.
Yeah.
And I hear from them they have a bharti to go to, they have an exam to go to, etc. But if you're not listening to it, maybe you'll later not be able to go for a bharti anyway, because
Yeah.
you'll be so injured
Yeah.
that recovery will be taking a lot longer.
So for the younger athletes that you're mentioning,
Yeah.
who are going for a bharti or something, usually the problem is with vitamin Ds. And that is something that can be fixed within a few weeks.
Wow.
Because I do get a lot of such athletes as well. My clinic is close to Shivaji Park, so I do end up getting a lot of them. And yeah, it's just a matter of, and if you go for vitamin D tablets available in generic shops instead of fancy pharmacies, they're dirt cheap. They're
Yeah.
not expensive.
Yeah. Do you have, I'm not saying it's medical advice, but otherwise, do you suggest a weekly dosage or daily dosage of vitamin D that people should take generally?
I generally suggest to people that you should get a blood test done once a year and fix it, right? I'll give you my personal example.
Yeah.
And this is not a recommendation.
Yeah,
This is
of
what
course.
works for me.
Yeah.
So I get a blood test done once a year.
Yeah.
If the vitamin D levels are low, I take the appropriate dosage to get it back up to normal. And then for maintenance, I take 1 tablet a month for maintenance.
Right.
Because I know from my own personal experience, and this works for me.
Yeah.
For someone else, it might be once in 2 weeks. For
Yeah.
someone, it might be once in 2 months.
Yeah.
For me, it's once a month. If I don't take it, after 2-3 months, my muscles start complaining. So I know that for sure. That's what I observed in me. So for everyone else, I would suggest get a blood test done, fix it.
See where you stand. So what I do, so I do it every year. And by the way, one of the years when I met you early on, you had suggested this to me, so I continued with it. I get my blood test done once a year. And how I do it, I stop my supplementation a month before.
Yeah.
And so 4 weeks, I let it continue and see where it reaches. Then I do my vitamin D test. And after that, I take a 60,000 IU unit once a week. And I'll do it for 4 weeks. I stop for 2 weeks, then do it for 4 weeks again. And this is what I've been doing it for years, and it remains between 45, 50. That's where I am.
Perfect.
And
that works
now,
for you.
Yeah, and most of the pains now have gone away, actually.
Yeah.
I don't get, otherwise I used to get pains at places.
Weird
I would think,
niggles.
I'd be like, why?
Yeah.
So what you're saying, I totally agree with. Now, coming up, the knees.
Yeah.
I keep hearing so much of information around it, and people, the first thing I hear that, hey, if you have knee pain, it possibly is coming from your glutes. Someone will say something else, etc. I know there are various reasons for it.
Oh yeah.
And again, not to overgeneralize, but the kind of target group we are talking about is recreational amateur runners who have started over a period of time. These are the common niggles all of us get. What could be some of the reasons for?
So I'll mention just 2.
Yeah, sure.
Because it's a big topic.
Yeah.
So I'll just mention 2. One which you can't prepare for, and one which you can prepare for. Okay. So the one that you can't prepare for is something called as meniscus pinching. So your knee joint, it's like a hinge, it bends and it straightens.
Yeah.
But the bones can also turn. Right? So your body doesn't want that.
Yeah.
So it's packed it from the sides with cushions, called as meniscus.
Right.
I'm being very crude here. So whoever doctor is listening to me, please don't blame me. So basically it's just to ensure that the joint gets packed and your bones are moving the way it's supposed to move.
Yeah.
But whenever the leg is in the air, okay, because of gravity, the bones are going to separate a bit. This happens with basketball. This happens with anyone who's jumping. Right? The bones separate a bit. And while landing, if the bones don't land perfectly, if they turn and land, the meniscus can get pinched. Okay. Case in point, if you're running on Mumbai roads. So your meniscus can get pinched. It's a pretty common occurrence, especially in sports where you're changing speed and direction fast, like badminton and football and basketball. But it can happen with runners as well. Okay, when you're turning or even when you're running and you had to jump over an obstacle or something, so you're in the air for a longer time, the bones can cause. It's a freak accident. You can't really prepare for it. And taking care of it is simple as, rest, ice, and, maybe wear a kneecap for a few days and it pops back in. It heals by itself. Unless it I mean, in very, 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 very few circumstances, the injury is bad enough that it requires you to get an MRI and see a doctor and all of this. But for the great majority of people, if you have pain around the inner joint line or something, it's usually you pinched your meniscus slightly.
Okay.
All right. The one that you can prepare for is pain in the front of your knee. The pain in the front of the knee is because your quadriceps is not doing a good job. Okay. You can describe it any way you want, but the bottom line comes to it is your quadriceps is not doing a good job. You can call it jumper's knee, runner's knee, patellofemoral issues, chondromalacia, whatever you want to call it. At the end of it, your quads is not doing a good job. So your kneecap, you're technically not born with it. It develops after your birth, and it develops inside the tendon of the quadriceps. It basically works like a pulley. So just like a pulley helps you draw water from the well smoother, the patella helps your quadriceps work your leg a little better. So if the quadriceps is not doing a good enough job, this patella rubs against the bone underneath, your thigh bone, and there's a lot of swelling that develops between your kneecap and the bone. So you end up with pain in the front of your knees, because your quads didn't do a good job of shock absorption.
Got it.
That is something you can prepare for by doing strength training.
And if it has happened, what do you do then?
Initially, you have to allow it to recover.
The
same thing, rest, ice, maybe wear a kneecap, and once the pain comes down, you get into strength training, slowly increase the strengthening, because your knee also takes 5 to 6 times your body weight when you walk and run. So if your quads aren't strong enough, then that creates a problem.
Got it.
Like someone like an Usain Bolt who used to scream down a 100-meter track in less than 9.6 seconds. His knees were taking close to a ton of pressure every single step.
Wow.
Which is why he could do a 400 kg 3-rep squat. That's the kind of power his quads needed to generate. So that he could run the next 100 meter as well and not pull out after his heats.
But people can imagine those quads did not generate that kind of power on their own. They needed to be trained, and that's why people need to do that training.
You can't pick up a 400 kg weight on day one. It's just not possible.
You talked about ice. We keep hearing most of the times people say, do I do a hot pack? Do I do an ice pack? On shin, on the knee, on feet, etc. How do you differentiate which one is better?
Many ways, but again, to keep it really, really simple, if you have swelling, you ice it.
Okay.
If you have muscle soreness, the kind of soreness when you go to bed in the evening and your calves start hurting.
Okay.
I'm sure people know what I'm talking about. That works better with heat. Okay. So when the idea is to reduce the swelling, ice works better. When the idea is to improve blood supply, heat works better. Now, even then, icing can't be done for too long, because if you do it for too long, you actually slow down recovery. So it's better to do 10 minutes 3-4 times rather than keep it for half an hour.
Got it.
Right? So you do 10 minutes and then a couple of hours later, you do again for 10 minutes. And don't use gel packs. They don't get cold enough, those blue gel packs. You're better off using ice cubes. So if you ice it for 10 minutes repeatedly, it helps reduce the inflammation and pain and swelling without adversely affecting the speed of repair by too much. The heat, on the other hand, has to be taken for longer duration, for more than 25 minutes or so. The reason is there are 2 ways to take heat. One is you keep it hot, and then it distracts the brain into thinking there's heat there, not pain, and you feel nice. So a lot of people prefer hot. And they'll keep it for a bit, they'll remove it, they'll keep it for a bit, they'll remove it. That's not what I want. I want the heat to penetrate in, relax the muscle, improve the blood supply. For that, it needs to be comfortably warm. Because you need to tolerate for 20 minutes without damaging your skin. So keep it comfortably warm for about 20-25 minutes. That improves the blood supply, relaxes the muscle, helps in the healing process.
Got it. So if I understood it correctly, because I know some listeners will have this question. If I've gone for a long run and I come back, I feel that I don't have swelling if I see it, but I do feel I'm sore. I'm inflamed. Now in that situation, I take ice pack. If I wake up next morning and I still feel there is a soreness and there's a pain that's going on.
In the muscle, heat. In the joint, ice.
Got it. Yeah, thank you. That was very important to understand. Now, you said that the ice pack should be taken, say, 10 minutes. Not like again 30 seconds, you put directly the ice cube on on your knee, you are not able to tolerate, you remove it. I think we are saying find a way through which you can tighten that area, keep it for 10 minutes, remove it, and then repeat is what we are saying.
In this case, no pain, no gain work.
Okay. All right. The moving up and possibly the last one is glutes.
Yeah.
Oh my goodness. All the times we hear everything is blamed on glutes.
Yeah.
Is that so?
Partially, yeah.
Okay.
Because glutes is the biggest muscle in your body in terms of cross-sectional area. And your body will not waste energy on something that is not required.
Yeah.
So if your glutes is the biggest muscle, then obviously it is very, very important.
Yeah.
It is important for locomotion, whether it is running, walking, swimming, cycling. And it is important for keeping your posture. So it works both ways. It's a big muscle. So if your body requires a big muscle and you strengthen it, obviously it will help in the biomechanics. Right. So strengthening the glutes is always important. In terms of blaming it for all the injuries, that will depend on what the injury is.
Sure.
So like I said, if it is the IT band, that could be because of the foot not landing correctly, but it could also be because the side glutes, the gluteus medius, is not working well. Your hip abductor muscle, it's not working well.
Right.
So depending on what hurts, you could blame one of the glute muscles. There are 3. Yeah, that can be done. You can put it to blame and you can strengthen it. Like I mentioned earlier, that your calves, your quads, and your 2 glute muscles should always be strengthened.
Got it. You talked about IT band, and I wanted to spend a little time here because when we start running, regardless of at what age, all of us have gone through this IT band pain issue. And in the start, it's not understood what exactly is this. It's only understood when a physio does this magic with his or her thumbs, and you feel like this is the most painful thing that has ever happened to me. Why is that happening at a very broad level? And how should people identify that early and prevent it?
Okay, so first, the IT band or the plantar fascia, both of them are non-contractile structures, meaning like muscles, they don't shorten and lengthen. Right. So if you are moving and you need to control that movement, the body will use a tissue that it can control well. Right. So when your weight is falling on your feet, your body will use muscles to control it, and not a non-contractile structure like plantar fascia.
Right.
It is when those muscles don't do a good job, that is when the plantar fascia gets involved and inflamed. Right. Similarly, the IT band is a supportive structure. It's a non-contractile structure. It goes from your hip to your knee.
Yeah.
And again,
On
because
both the
it's not
sides.
on both sides, because it's a non-contractile structure, it will only get inflamed and work hard if the muscle that should be doing the job doesn't do the job.
Okay.
In this case, the muscle that should be doing the job is your hip abductor or gluteus medius muscle.
Yeah.
Now, we are both sitting,
Yeah.
right? And we are not taking 50% of our weight on each of our butt.
Yeah.
We are constantly subconsciously shifting weight from one side to the other.
Yeah.
All of that is happening because of your glute med. It shifts the weight from one side to the other. This happens when you're standing. This happens with every step of running.
Got it.
Except when you're running, the movement has to happen faster than when you're sitting. So if the muscle is not used to it, like you said, people who just start off and get IT band issues, if the muscle is not used to it, or if the flexibility of the hips is less, flexibility also matters in this case, then the IT band gets pulled and gets inflamed. So you need to strengthen the hips, and you need to make sure you're at least basic flexibility.
Got it. And here, if this has happened, do I go for those painful sessions?
Initially, you may have to,
Right.
but depending on how bad it is, like if it is 3 on 10 or less, you can just foam roll it, stretch it, strengthen the glutes, and you'll find it goes away. If you have waited till it got to 6 or 7, then you might need to undergo some of those painful sessions.
Got it. Awesome. I think listening to this, many people would want to reach out to you and maybe have you do the difficult job of finding out what's wrong, if at all there is any. You do have, I think, 2 clinics
Yes.
in Mumbai, one that you've opened recently.
Yeah.
Do you want to talk about what kind of practices do you have in your clinics, and what are the things people should go to you for?
Like I said, I'm a physiotherapist and a sports scientist, so I do both. So I have a clinic in Dadar and a clinic in Mulund. I have a full sports science lab where we do actual gas analysis for VO2 max. We do 3D motion analysis. We do foot pressure. I have a proper pressure plate. And I've got all this equipment because I use it on Olympians, right? So people like Lakshya Sen, Vinesh Fogart, Bajrang Punia, Mirabai Chanu, we've used all of this equipment on them for high-end exercise physiology and biomechanical assessments. And of course, any of you who have issues with your gait, who want to know your VO2 max, how to optimize your training based on the VO2 max is a little bit of a red herring. What you want to know is percentage of VO2 max that is actually used. Like for example, you've done the test. If your VO2 max pace is say 17 kilometers per hour, you're not running a marathon at 17 kilometers per hour, right? You're running at a percentage of that, and that usually corresponds to your aerobic limit. So you want to know what that limit is, how to optimize it, how to make it better, so that you are able to run faster for longer and achieve your PBs. So all of those stuff we do, whether it is mapping out your foot pressure, looking at your gait, looking at your biomechanics, looking at your VO2s, looking at your lactates. We do all of that in terms of sports science stuff. I'm a physiotherapist as well, so we do handle injuries. We do help you get back on your feet. I do have extensive experience working with high performance athletes for close to 2 decades now. So we draw insights from what works at the highest level. And so, for example, if you have 3 weeks for a race, what's the best way to make sure that your race goes off well? And we'll pick up the pieces later. So all of those, those small bits and pieces that go towards helping you achieve high performance, that is what we can do. We do strength and conditioning, physiotherapy, rehabilitation, sports science, and by far the most important component that we do in our clinics is recovery. Because as you mentioned that most people don't eat, sleep, train, repeat. Right? They eat, sleep, train, take care of the house, take care of the family, do a 10-hour high stress job. And, so you're always running a little bit of fatigue. So identifying what is holding you back, what is causing all the fatigue, and taking care of it. So we offer full body icing, compression releases, and all of those things specifically designed to help you recover.
Nice.
So recovery is like the cornerstone of what we do.
Super. And how do people reach you or your team?
Just the website or our numbers on Google work well.
And what is it? Sorry, I mean,
prophysio.co.in. Prophysio is the name of my clinic. It's the pro version of physio. I know it's stupid, but it's okay. Really great athlete of India who's won an Olympic medal gave me that suggestion, so I couldn't ignore it.
Nice.
So Prophysio is the name of my clinics, and we have branches in Dadar, we have branches in Mulund, and you can connect to us on our website prophysio.co.in, or on our social media, or on the numbers given on Google.
Got it. And look, I think it's a pretty cool name, Prophysio. Have it flaunted. Why not, right?
Why not?
Look, Dr. Latey.
We have an even more pretentious tagline.
Is it?
Oh yeah, it's called Performance Amplified.
Nice. I think if people want to amplify their performances, they should look you up. And again, not a sponsored content, but I highly recommend you personally from my own experience as well. And you've been a great partner. Thank you so much for doing everything that you've done for running community and coming here and talking today. We hopefully will create more content together.
Yeah, sounds good.
Thank you very much for being here.
Thank you.
See ya.